Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Becca Rose, who is the owner of Myofunctional Pathways based out of the Sheboygan area. Becca was a dental hygienist for over 20 years, and during her time in that career, she was introduced to a concept called myofunctional therapy. When her son was 3, she began to notice mouth breathing, a setback lower jaw position, and that he was sick a lot, which motivated her to learn more about how to help him and what myofunctional therapy really was. Through the learning process, she actually discovered that her own airway dysfunctions were the reason why at age 28, she had been diagnosed with sleep apnea and prescribed a CPAP machine. Becca became more and more passionate about this newly discovered missing link within her own family's health journey, so she decided to pursue sleep coaching, functional breathing, and myofunctional certifications, and to ultimately help others through this career. It's obvious that Becca practices what she preaches because as of 6 months ago, she no longer needed the CPAP machine she had been using for 14 years. Outside of work, Becca's hobbies include family activities with her husband and 7-year-old son, and expanding her podcast. And if you guys want to check it out, it's called Myo 360, Holistic Solutions for Better Sleep and Better Breathing. If you've never heard of airway or oral dysfunction or myofunctional therapy, you're not alone, but I will tell you that these episodes could literally change your life. You'll hear us, Drea and I, talking about personal experiences within all 4 episodes as well, because our kids and my husband have benefited from myofunctional therapy in the past. And I can't forget to mention that Becca is offering a special discount for our listeners. You can receive $50 off your myofunctional evaluation by mentioning the Motherhood Alliance podcast. In our 4 episodes together, we cover a plethora of areas that myofunctional therapy can help, including mouth breathing, teeth grinding, poor sleep quality, sleep apnea, bedwetting, ear infections, crooked or crowded teeth, TMJ pain, and more. So turn up your volume and let's get started with today's conversation.
Hey guys, welcome to the podcast. We have Becca Rose here, and we're so excited you're here today, Becca.
Thank you.
Yeah. So we are going to be talking about mouth breathing, teeth grinding, and poor sleep quality, and how myofunctional therapy can help. I'm really excited to dive into this episode. Britt and I both have kids that have gone through myofunctional therapy, that are going through it, and there's a lot of really awesome things that we're going to learn here in this episode and the following one. But before we get into that, we always like to kind of talk about fun facts with our guests. And something that you had said is you can never have too many quirky coffee cups.
Yeah, I like to collect coffee cups. They're so unique, and I don't know, I just like them.
What's your favorite one?
It's actually from the wilderness out in the Wisconsin Dells. I don't know. It's just got a certain feel and look. There's something about the feel of your coffee cup, right?
Yeah, I totally get that. And what was that you said before we started the podcast? It was ironic.
So I am a sleep coach as well as a myofunctional therapist, but I love coffee and I drink so much of it. Not because I need the caffeine to wake up, because I sleep amazing. I just love coffee. So the coffee cups go right along with that.
That's awesome. All right. So let's just get started with our first question here. So what is myofunctional therapy and how did you discover it? Just tell us a little bit about your story too with that.
Sure. Probably the easiest way to describe myofunctional therapy is a muscle dysfunction in the face. tongue, throat. So any of the muscles that are supporting the mouth structure and around the mouth, if they don't work to their fullest potential, then there's a dysfunction there. So myofunctional therapy is essentially a muscle therapy program that refocuses on training the muscles in and around the mouth and face. And I found out about this years ago when my son was young. He had a very set back jaw, and being in the dental environment for over 20 years, I noticed right away, well, I remember saying to my husband, my baby, where's your chin? Because his chin was set back so far. And he also always had his mouth open. So I knew that there was something wrong with that as well. And as he got older, he started having a lot of trouble with sickness, head colds, chest colds. He missed a lot of days of school. And yeah, that kind of got me interested in looking into the myofunctional therapy part. And then I was able to connect my own experiences to that as well.
I really feel like a lot of moms and parents that are going to be listening to this they're going to really be reflecting a little bit on their own kids' issues. Because this is, I think, maybe you have a stat, I don't know, but do a lot of people have these kinds of issues that just don't know that they have a myofunctional dysfunction?
Yeah, I don't have an official number, but if I had to put my own personal guess, I'd say at least 75% of people have some sort of oral facial dysfunction. And that's not just one symptom. So you're looking at a whole boatload of different symptoms and how they can possibly connect to a myofunctional disorder.
So I think my first question is, how did we get there? Has this always been a challenge in society, or how did we get this way, and why is it so common in today's population?
So we have not always been this way. The reason we are this way now, it's projected, or it's perceived to be from soft food. So if you think back to like the prehistoric days or the Neanderthal days, and you look at those old skulls and they show the teeth are all perfectly in line. All 32 teeth are perfectly lined up. The jaws are nice and wide, and the whole skeletal structure is much bigger than what we see in humans today. If you look at most people, including myself, we tend to have longer faces. And our upper airway and our jawbones have shrunk in size, so they're not as wide as they used to be. They say, if you think back to those times, they didn't have soft food. They had to work for their food. Even as a baby, an infant with no teeth, you had rough meat you had to break down. You had rough vegetables that you had to break down. That's how you survived. So that's essentially the definition of baby-led weaning. You want to be able to give your baby harder foods that present a challenge, because without the forces of that food and those jaws breaking down the food, you're not going to be able to stimulate that jaw growth, but then the tongue is also not doing its work either. So to talk about a baby who, say, it's 4 or 5 months old and they have no teeth, but they need to break down meat, they have to use their jaws to grind the food down, but they also need to use their tongue to drag their tongue across the top of their mouth. And if you take your own tongue and you feel up on the roof of your mouth behind your front teeth with your tongue, you should feel some lumps and bumps and ridges up there. That essentially works as like a washing board where the tongue mashes against that structure, and that helps a baby, or even nowadays an edentulous or a person with no teeth, to help break down their food. So we don't have to do that anymore because we have processed food, baby food pouches, applesauce pouches, everything dissolves, crackers. So we don't need to work so hard. And then over time, now this is not genetic change, this is like epigenetics, so it's considered environmental change. If we were to start using our jaws again and our tongue, over a few generations, our faces would start to grow bigger and broader, our airway would get bigger again. So a lot of this is environmentally based.
So does this also correlate with why, I feel like a huge majority of kids these days need braces? Like our teeth are not coming in straight most of the time. When you have kids, you expect that you will have braces payments in your future. Is this connected?
Absolutely. With the tongue not resting up against the roof of the mouth, it rests low. And when it rests low, there's no pressure of the tongue up in the jaw to help form the shape of that jaw. On the other side, because you're not supporting the upper jaw with the tongue, the pressure of the cheeks come in and they almost like squeeze against that upper jaw. And a lot of times are we not only having narrow jaws, but they're growing tall. And that pressure of that upper jaw then puts pressure on the nasal septum. And so in my own son, he was a few years old and he had a deviated septum. You're like, what's going on? He never fell. He didn't smash his face on the ground or get hit by a ball, but he had a deviated septum because the roof of the mouth is also the floor of the nose. So if the roof of the mouth is growing high and vaulted, it's going to push on that nasal septum as well.
So that's why he was mouth breathing?
Yeah. He also had pretty large tonsils and adenoids. That wasn't evident right away. That came with years because the mouth breathing increases inflammation in the throat. You bypass the nasal system and those tonsils and adenoids tend to get pretty large. So we had to address that at some point.
Oh, and then of course, if he's mouth breathing, his tongue isn't in that spot, right?
Right.
Behind that tongue, like right behind the teeth.
Yeah.
So it's not supporting.
Right.
Interesting.
And when you look at a child who has their mouth open, their tongue is going to be down by their lower teeth. And then that just causes more trouble and trouble down the road as we get older. Yeah.
I just wonder, like, if anybody's sitting here listening to this, where's your tongue right now?
Right.
Where's your tongue? Like, where do you usually put it? Nobody really thinks about that. Yeah.
Yeah, and I bet everybody here can think about somebody who's more of a mouth breather, whether it's a child or an adult.
Yeah.
Yeah. So you kind of define what myofunctional therapy is, but so how does this actually help? What are you doing with myofunctional therapy to fix all these issues?
So there's 4 main goals of myofunctional therapy. We need to establish lip closure, nose breathing, and proper chewing and swallowing function, and a correct swallow. So with that, we teach the muscles how to behave in different ways. We do lots of different activities to help encourage those movements.
Okay, that makes sense. So how long of a process would this be? And when you're saying exercises, I think of like physical therapy. So is it similar to something like that? Or are you using tools? What does this actually look like?
So we do use a lot of tools and different props. Sometimes people will compare myofunctional therapy to physical therapy, but we can't say physical therapy because we're not physical therapists, but it makes sense to people to describe it that way. We use tools to help strengthen the muscles. It's really deceiving sometimes because people think that, we're just going to get the muscles strong. And it's not about strengthening the muscles. We have to teach them how to function differently, because the biggest end goal of myofunctional therapy is to create a habitual integrated swallow pattern. And then as you swallow continuously thousands of times for the rest of your life, or every day for the rest of your life, you continue to do your myofunctional therapy. So it's about function.
Yeah. I just think, like, somebody might come to you with many different kinds of issue, or one kind of issue. And, you might have to tailor your myofunctional therapy for them specifically, and another one would come to you for something else. So, you have to really think about the individual experiences too.
Correct. Everybody has a different story. They have a different set of symptoms. They have a different desired outcome. So everything I do is completely personalized and tailored to each individual person. We don't do any cookie cutter work where I am.
And I don't know if people realize this too, but dentistry is huge too. So like, not every dentist is necessarily passionate about this or knows about this too. Can you kind of tell us how specific dentists who work with myofunctional therapy or have education about this, how do you work with them, or how does that work in their office?
You're right. A lot of doctors and dentists don't have any experience in myofunctional therapy, and they've never heard of it. You have to have a desire to want to learn about it. When I was in school for dental hygiene, I never heard of this. And same thing with the doctors. They've never heard of it. So unless something sparked their interest, or they had a personal or family situation that, like, their light bulb went off and they'd pursued some training, they don't know about it.
This is what makes me frustrated, because we have a great dentist here locally that told us all about this stuff with our kids. And I just don't know how people will understand, like, what's wrong with me. And these are basic issues and symptoms that people are having. Their kid is always coming home sick. They're having ear infections. They have all this other stuff going on that seems normal. So they get their tonsils taken out or their adenoids, and nothing's getting fixed, but it has to do with the mouth. So if the dentist isn't the one that's the first line, like, person there helping, how are they supposed to learn about this stuff?
Right. I know it's very discouraging.
Yeah.
But on the plus side, there are many, many doctors and dentists who are starting to understand this. And there's more airway focused doctors and dentists showing up. So they're understanding the link. And interestingly, you're right. The dentist environment should be the first person. It should be the first place that some of these issues are seen because we are in the mouth all the time. The American Dental Association strongly encourages some of the sleep disordered breathing and sleep apnea screenings being done in a dental office. But as you know, that doesn't happen quite often because if it doesn't have a direct impact on their practice, it's not a focus.
So you mentioned sleep. So I actually do want to ask a little bit about that because you're talking about probably mouth breathing during the day. The exercises you would be doing would be during the day. What about nighttime? So I know a lot of people grind their teeth or even sleep apnea. So how does this dysfunction in the mouth, the jaw being set differently and the teeth being more crowded and impacting up into the nasal cavity, how does this affect sleep?
So as you start to strengthen and coordinate and tone, put endurance into the muscles and start to create function, new muscle memory starts to happen. So myofunctional therapy is what they consider neuromuscular. So you're going to make new neurological connections from your nerves to your muscles. And then as you learn new breathing techniques through the process as well, your body then, you get good at it during the day, and then your body starts to take on those same habits at nighttime. So when the tongue is in the right place and you learn how to breathe at a proper rate and it's not too fast, those things then go to nighttime. It helps to keep the airway open and prevent the throat from collapsing or the tongue falling back into the throat with that sleep disordered breathing or sleep apnea events.
Okay. And we are going to talk about sleep more in episode 2. We're going to really dive into that. But another one that I also want to have an intro on here is tongue ties. Like this is so common now. And like you were just saying how myofunctional therapy really is just coming out of the woodwork. People are really just starting to learn about the importance of it. But tongue ties or oral ties have become really well known. So how does that link in with this whole piece that is kind of an epidemic now? Why are tongue ties so common and what should we be doing about it?
So if we link back to the beginning when we talked about the tongue function in babies to having to grind down the food, as we've stopped having to do that, the tongue doesn't have to stretch up as far to grind up against the roof of the mouth to break down food. So over time, then the tongue starts to stay lower and that fascial tissue connects the tongue to the floor of the mouth. That doesn't separate like it should in utero. Then with the tongue ties, there's different kinds of tongue ties. There's some that are more anterior and there's some that are deeper. I'm looking for one that's deeper, or it's called a mid-tongue restriction or a posterior tongue tie. That's not a term that many people have heard about. We all know about the baby with the string right on the tip of their tongue. We've all seen that. An untrained eye can see that across the room. But we're looking for that mid-tongue or posterior restriction because that's the part that prevents the whole tongue body in the back of the tongue from being able to engage on the roof of the mouth to help create good breathing patterns and good tongue posture. So that's what we're looking for. And pediatricians, dentists, they have no idea what that means.
Wow. You know, I when my kid, my oldest son, I had a lactation consultant come to my house and she had some tongue tie experience, not as much, I feel like, as some of the members in our Motherhood Alliance directory do, but it was really very interesting because one of the things she told me about tongue ties too is that even as adults, you know, she was giving me an example of a woman or a man, I don't remember, who had a heart attack at like 30 something. And they found out it was because he had a tongue tie or some kind of tie that actually pulled all that, like his heart and everything up towards. So it was like a pulling. It was really bad, apparently. So, I mean, it's like, you're not just talking about pediatrics. We're talking about like adults who are either misdiagnosed or never diagnosed with tongue ties and lip ties and things like that are affecting their entire body systems.
Yeah.
It's crazy.
I'm working with 50 and 60 and 70-year-olds right now.
Okay.
Who are in that boat.
Yeah.
Mm-hmm.
Yeah. My husband has had, some chronic muscle challenges in his upper shoulders, his neck, things like that. And because we do go to a dentist who is aware of these things, he actually had a tongue released done as an adult. I don't think people know that's very common, or it can be a very great solution.
Usually
for them.
you just hear tongue ties and you think babies. It's adults, it's kids, it's everybody that should be at least looked at for these things.
Right. And I just had my own tongue tie released about 6 months ago. After doing Myo for 3 years, I'm like, it's time.
How did that feel? Like, did you feel a big difference?
Oh
like,
my gosh.
Tell us about that.
Yeah, it was incredible. I have a history of migraines, really bad sinus. I've had sinus surgery. Oh my gosh, all the things. And I've been doing myofunctional therapy for over 3 years. And you can have significant improvements in your symptoms without always needing to have a procedure, a tongue tie release procedure.
Okay.
I ultimately decided to do mine because I just had so much tension through the front part of my neck and down into like my collarbone and my shoulders. Like, you know what? I think I'm just going to do this. And my headaches went away. I had that daily like nagging just headache that's always there. You can never really get rid of. And that disappeared. My range of motion of my neck side to side, up and down was significantly improved.
Like next day improved?
Like immediately.
Immediately.
Yeah, I sat up in the dental chair and I'm like, the first thing I did was turn my head and I'm like, this is wild. I cannot believe this. And I remember in the car on the way home, taking some videos on my phone of just showing my range of motion and, showing my tongue. And it was just crazy. I wish I did it years ago. And that's what every single adult says when they come for myofunctional therapy and they finally decide, I'm going to do my tongue tie release. They say, I wish I did this. I wish I knew about this 5 years, 20 years ago, however long ago.
Wow.
How does somebody find out if they have a tongue tie that could be causing symptoms like headaches and things like that?
So the best thing to do would to find an airway focused provider, whether that be a dentist or a myofunctional therapist, because we are specially trained in being able to assess and determine if that posterior tie is there. So again, it's not just about what it looks like, it's based on function. So if you come for an evaluation, I'm going to do a whole bunch of different things, movements, sounds, eating, chewing, swallowing, to see how everything functions together. Also looking at the shape of your mouth and lots of different things. And then we determine, okay, there's different grades of tongue ties. So I'll give you an idea of where you fall. And then we talk about how that is potentially impacting your symptoms. And you have to remember, with an adult especially, if they're looking for myofunctional therapy, they've often tried everything already. They've had night guards, they've had CPAP machines, they've been to this doctor, they've had this and that therapy.
They've gone through all the traditional things until they finally figure out this might be it.
Yes, exactly.
Yeah. Oh, I wish this could be like the first thing. And hopefully it will be with these kinds of episodes. Oh,
I do have one more question for this episode specifically, but I want to circle all the way back to how we started with kids and kind of how our genes have changed over time. Our mouth's shape has changed over time. So if somebody is listening to this and let's say that they have little babies and they're just starting to eat solids, what can a parent do as they're raising up their little kids to help prevent some of this and get that jaw structure proper in the beginning?
Chewing. That is in breastfeeding. If you're able to breastfeed, that's going to be ideal. I couldn't breastfeed my own child, so we can't all do that. But chewing, encouraging that true baby-led weaning. Obviously, make sure they're supervised. You don't throw a carrot at them and walk away, but allow them to use their jaws. We can start to guide that growth when they're very young, but the shape of the mouth and the tongue tie is already present in utero. But the younger they are, the more you get them moving, because that fascia, that muscle is very pliable when you're little. So if you can keep those good habits started young and keep them going, they have much less likelihood of developing to these more chronic myofunctional disorders.
Awesome. Thank you for that. And we will be talking more about kids specifically in episode 3, so stay tuned for that as well. So Becca, if people are listening to this and they're like, holy cow, I've never heard of this. I have some of these symptoms, or I know someone who does. What if this could be my missing link? How do they contact you? And do you offer like a free consultation where they could just ask questions, or how can they start to get more information?
I would visit my website, myofunctionalpathways.com. I also, if you look up Myofunctional Pathways on Facebook or Instagram, I also post some videos and some informational things there. They're sometimes easier to follow than a website page. But yeah, I do offer a free 30-minute Zoom call to answer questions for people before they decide if myofunctional therapy is the right thing for them.
This was super informative, and I think that it's going to help a lot of people because, like we talked about, this is not necessarily something that's on people's radar, whether they're professionals or they're just the average Joe and they don't have any knowledge in the health field. So I think you're going to change a lot of lives with this, and we can't wait to continue our discussion in the next episode. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.